Welcome to the Michigan Trauma Quality Improvement Program. In this section of orientation, we will review the processes of care for opioid use. Tablet type 1 is the type of opioid tablet prescribed for the patient at discharge. This includes opioid capsules when prescribed instead of tablets. Report only the opioid component of a combination medication. For example, if a patient is prescribed Percocet, which contains both oxycodone and acetaminophen, report oxycodone and the information related to the opioid component only. A drug search link is available in the resources section of the data dictionary to assist in determining the correct opioid type. Do not report this data element if the patient elopes and the discharge prescription status is unknown. Tablet type 2 is reported when an additional opioid tablet or capsule is prescribed for the patient at discharge. Report only the opioid component of the prescription. In rare cases, a patient may be prescribed more than 2 types or strengths of opioid tablets or capsules at discharge. When this occurs, report the 2 opioid prescriptions with the highest oral morphine equivalent, or OME. Do not report this data element if the patient elopes and the discharge prescription status is unknown. Solution type 1 is the type of opioid solution prescribed for the patient at discharge. Report cartridges, concentrates, elixirs, liquids, pen injectors, pump reservoirs, syringes, and other similar dosage forms that are prescribed and reported as units per milliliter in the solution data elements. For combination medications, report only the opioid component of the prescription and the information related to the opioid component. Do not report this data element if the patient elopes and the discharge prescription status is unknown. Other type 1 is the type of opioid prescribed for the patient at discharge that is not in a tablet or solution dosage form. Examples include transdermal patches, buccal films, lozenges, suppositories, and sublingual films. For combination medications, report only the opioid component of the prescription and the information related to the opioid component. Do not report this data element if the patient elopes and the discharge prescription status is unknown. Strength refers to the strength of the opioid prescribed for the patient at discharge and is reported as a numeric value only. Report only the opioid component of the prescription. For example, if Percocet, which is a combination of oxycodone, 5 mg, and acetaminophen, 325 mg, is prescribed. Report 5, representing the 5 mg of oxycodone. Round to the nearest tenth where applicable. Units refers to the drug units of the opioid prescribed for the patient at discharge and should be reported based on the opioid dosage form. Report only the opioid component of the prescription. Milliliters of solution refers to the milliliters of the opioid solution prescribed for the patient at discharge. For example, if a combination of acetaminophen 120 mg and codeine 12 mg per 5 milliliters of oral solution is prescribed, report the numeric value of 5. This represents the milliliters of the solution, not the medication strength. Round to the nearest tenth where applicable. Forms refers to the dosage form of the opioid prescribed for the patient at discharge when the opioid is reported in the other type category. Report the appropriate element value for the dosage form. If the prescribed form is not listed among the available element values, report element value 8, other. Maximum per dose refers to the maximum amount of opioid prescribed that may be taken with each dose at discharge. For example, if oxycodone 5 mg, take 1 to 2 tablets every 4 to 6 hours as needed is prescribed. The maximum amount the patient may take per dose is 2 tablets. Report the numeric value 2. Several other examples are also provided for your reference. Round to the nearest tenth where applicable. Maximum frequency per day refers to the maximum number of times an opioid can be taken within a 24-hour period based on the prescription instructions at discharge. For example, if oxycodone 5 milligrams, take 1 to 2 tablets by mouth every 4 to 6 hours as needed is prescribed. The patient may take a maximum of 6 doses per day. Report the numeric value 6. To determine the maximum frequency per day, divide 24 hours by the shortest prescribed dosing interval. In this example, 24 hours divided by 4 hours equals 6 doses per day. Several other examples are also provided for your reference. Quantity refers to the total amount of opioid prescribed to the patient at discharge. Report the quantity based on the opioid dosage form. Tablet. Report the total number of tablets prescribed. Solution. Report the total milliliters of solution prescribed. Other. Report the total number of units prescribed. For example, patches, lozenges, or other applicable dosage forms. Round to the nearest tenth where applicable. Patients discharged to an acute rehabilitation facility or skilled nursing facility may have an opioid prescription ordered or listed on the discharge summary without a quantity documented, because providers at the receiving facility will continue to prescribe and dispense the medication. In these cases, report the opioid prescribed and enter 0 for the quantity. Thank you for watching.